Dr. Marquez here at Back Pain Relief Center. Today I'm going to go over the top 5 things I teach my patients to do when they have an episode of back pain before they come in to see us. We always want to have them do these things at home because they may be able to relieve their pain at home and get to a comfortable position, and they may not have to come see us. We have Archie here today. He's going to help us show these top 5 things. Okay, tip number 1 when you're having an episode of back pain that you can do at home that may prevent you from having to come see us is ice your back. Very, very important. Let's put ice on that back 15 minutes every hour while you're laying down. So I'm going to have Archie lay down. I'm going to use a pillow to put right under his belly to kind of elevate his back a little bit. And we want to do that to open up the disc spaces there and to relieve a little pressure on the back. So the first thing you're going to do is just get a nice back. In our office we use weighted ones. A plain bag of ice will work just fine. You're going to put it right on the area of pain. If you're experiencing pain on one side, you can still ice that entire low back. The key here is 15 to 20 minutes per hour. Alright, tip number 2 to help manage your pain at home when you're having a flare-up or an episode that can prevent you from having to come see us is use a TENS unit or an electric stim unit. Here at our office we use this particular TENS unit. I know they sell some at the local drugstore, or you could possibly have your doctor prescribe you one. Okay, so we have a TENS unit here. With this particular unit, we have 2 different sides. Each side has a couple of electrodes, and we're just going to place them on the low back. Even if you feel pain on one side or the other, it's still a good idea just to put 2 of the stickies on each side. And we'll place them about 2 or 3 inches apart. We always get a lot of questions on how strong we should have it. When you turn your unit on, we want it strong but comfortable. We don't want your back to spasm while you're doing it, so right under there. So just a nice, strong, comfortable pulse. And that's going to help block that pain signal to your head and get you to feel a little better. Okay, tip number 3 to help manage your back pain at home is to use a topical analgesic. Here at our office, we use a brand called BioFreeze. We use this a particular roll-on product. Just roll it on the area of pain that you're experiencing, and you can use that as much as needed. This is a great brand. We love it a lot. Patients like it. There's multiple brands out there. You can just go to your local drugstore, either ask a pharmacist or your physician and see which one that may work best for you. Okay, for tip number 4, we have Dr. Avakian here from Back Pain Relief Center. She's going to go over some stretches that we want you to do daily while you're feeling your back pain. We're going to use Archie here to go through these stretches.
So I'm going to go over 4 main stretches that you can do on a regular basis to prevent low back discomfort and help prevent tightness, but also during an episode of back discomfort, it will help to loosen things and alleviate some of your pain. We're going to go over 2 seated and 2 standing. So the first seated stretch, you would sit up nice and straight, nice straight low back, best you can do with discomfort, and then you're going to cross one ankle over the opposite knee, best that you can. That's perfect. You don't need to put any pressure on the knee or press on it at all. And then the whole movement is actually very small. You're just going to hinge forward at the hips. You don't want to curl your back. You're not trying to reach very far. It's a very small movement. And that's actually plenty to take a nice, smooth, even stretch into the buttock and hip area, which are the large muscles that attach into the low back and can sometimes cause you discomfort. You can relax. And you want to hold your stretches for about 15 seconds. All stretches are going to be done on both sides. And then I would say four stretches on each side. So you would do that 3 more times on that side. And then he's going to do it 4 times on the left side. The other seated stretch is actually a little bit rotational, and it pulls more into the buttock again, but also a little bit down into the lateral or side of your thigh. And all you're going to do is cross one knee over the opposite knee. A nice straight back is key and important. And then he's going to take his opposite hand and gently turn your belly button towards the wall. Now Archie's obviously very fit, so he's able to turn a good bit. With back pain especially, you might only be able to do a small turn. You can relax. And a very key point on these stretches, you might hold them for up to 15 seconds. That's the most effective amount of time, but you want to really concentrate on your breathing because it's the breath in and out that's gonna actually relax the muscles. Okay, and so now we're gonna go over 2 standing stretches. One is for the middle hamstring, which is down the back of the thigh and attaches up into some of the buttock muscles. So this is gonna be a one-legged stretch. So if your balance isn't really good or you're having a lot of pain, you might wanna set up a chair to hold on to for balance. So you're gonna stand, I'll have you move a little bit closer, perfect, and I'm gonna have you stand on your right foot to start. And what you're gonna do to isolate the middle hamstring of the opposite leg, the leg you're standing on, you turn those toes in. And then you're gonna put your left leg up on the stool. You wanna put your heel up and point the toes towards your body. Nice straight back again, and you're gonna, again, hinge forward at the hips, not curling the back, a nice straight back, so it's a very small movement, usually not too bad when you have a lot of discomfort. You're gonna feel this into the middle hamstring in the back of the thigh, so the center of the back of the thigh. If it's very tight or your low back is very uncomfortable, sometimes into the calf and even the buttock. You can come up. Again, you wanna work on holding that for up to 15 seconds is a nice maximum stretch, and concentrate on the breathing, and you're gonna do both sides. The other stretch is actually for a muscle in the front. It's called your psoas, which attaches from the pelvic and actually goes through the abdomen and attaches into your low back on the lumbar spine. And for this stretch, you're gonna just kind of scissor your legs. You're gonna step one leg forward. You're gonna bend the knee slightly. The back leg, you wanna have the entire foot flat on the floor, and you wanna keep your heel flat on the floor the entire time. And all you're gonna do is try to bend that knee a little bit forward, not coming over the toes. You don't wanna arch the low back. It's a very small movement again. And you should feel that into the front of the thigh right here, up into this area. And that's gonna help stretch that muscle. Again, you wanna concentrate on the breathing, about 15 seconds, both sides. You can relax, Archie, thank you very much. And then, if you can manage, if your pain isn't too bad, 4 times on each side, which is also very good to prevent tightness so that you don't get low back pain episodes.
Okay, tip number 5 for relieving or managing your low back pain at home is wearing a pain relieving back support. This one we use here in our offices, works quite well. We want to do something to support these aching back muscles that could be contributing to your back pain. For this typical belt, we're going to put on, and these work well because it has a posterior panel and an anterior panel, or front and back panel, that reduce the amount of pressure on your low back. We tighten them up by using the side straps. You want to wear these when you have low back pain because you want to support that low back. You want to stop it from further injuring it or further inflaming it. And what this will do is give support to your low back. It'll give support and decrease stress on the aching back muscles that could be contributing to your pain. We tell all of our patients at home, wear this thing as much as needed. Obviously, you don't need to wear it while you're sitting down or just relaxing, but if you're up and moving around, we want you to wear the back belt until you start reducing your pain. Okay, to recap, top 5 things to help manage your back pain at home. Number 1, we want you to ice your back 15 minutes per hour. Number 2, we want you to use a TENS unit or an electric stim unit on your low back 20 to 30 minutes a few times a day. Number 3, we want you to use a topical analgesic like BioFreeze as needed. Number 4, we want you to go through the stretches that we showed you. And the last one, number 5, we want you to wear a pain relieving back support as much as needed. Do these 5 things for me. Do them every day until you begin to feel better. If you don't begin to feel better, say after the 3rd or 4th day, give us a call and we'll get you in the office and see what's wrong.